Okay, I'll go ahead and get started. I'm Dawn Ellison. I'm on the core for Healthcare Reinvention Collaborative. And our other core members on the call today are Denise Wiseman and Jennifer Beach and Paul Behrens. And Keely's probably seeing patients at this time of day. So we are fortunate today to be shining a light on the work of a couple of our network members. And I'm going to introduce them here in a moment. You'll recall that our mission is to identify, connect, support, and illuminate every healthcare change maker. So we're really excited to be shining a light on our guests during this April Shine a Light event. So we have two guests today. They'll be given approximately 10 minutes to describe their work, and then they will ask for what they need from the community and offer what they can to the community. And while they're informing us about their work, please feel free to let them know what you can offer them as well as what they might offer you in the chat. I want to be sure we have time to get to both of our guests and then have a rich conversation. So when each is finished speaking, I will then introduce the next guests and we'll continue until they've both had a chance to describe their work. And again, ask for what they need and offer what they can. So when they're finished, I'll open things up for a conversation, at which time you can ask more about their work, discuss possible collaborations, or just express appreciation for what they're doing. So our first guest is Lena Latner, no, Laturner, with
Done.
over
LaTurner.
Laturner, I got it. Okay. With over 17 years of experience in healthcare sales and marketing across diverse organizations from startups to Fortune 10 companies, Lena empowers change makers and leaders addressing critical healthcare challenges. She excels in strategic thinking and sales coaching, driving innovative solutions and stakeholder collaboration to achieve revenue growth and organizational alignment. By leveraging her industry knowledge, she informs clients of impactful trends and has helped numerous small businesses identify key areas of opportunity while staying true to their core principles. Lena, please tell us about your work.
Don, thank you everyone for joining. So I'm going to share a quick um, slide that I put together so that it makes it a little bit easier for you all to understand exactly what I do without wondering how that affects you. So I titled this Meaningful Impact because started Windmill Solutions after I left corporate in order to make a meaningful impact in healthcare. And I had originally been in Fortune 10, Fortune 500s in all aspects of sales and marketing, and with almost any product you can think of. And when I left, I was like, gosh, I really want to make my mark on healthcare and do it in a way that matters. And so I was focusing on women's health. And as I went to all of these startup accelerators, I realized that a lot of my counterparts didn't have the background, the training in sales. And because of that, they didn't feel as confident. So I pivoted and started to consult and coach people on how to sell in a way that felt authentic and felt like they were making connections and being genuine to themselves and their mission. And so that is what I have done with Windmill Health Solutions. This is what I hear all the time. So when I was trying to figure out what to talk to people about, I was like, okay, this is what everyone's been saying to me lately is I'm stuck. I don't know what to do. And so I'm just curious, has anyone else on this call felt like that lately with what you're trying to do? Denise.
Yeah.
Okay, thank you for participating and raising your hand. I appreciate that. So there's a lot of different reasons why people feel stuck, but when I talk about it and when they're talking to me, it's more about making the connections or they're getting these amazing connections through friends, family, professional relationships, but it doesn't really get to the end where they sign up for their product or they join their community or whatever else it is that they're hoping to get, a sponsorship, a partnership. And so I wanted to share that that is totally normal and a few of the top challenges in sales across the board so that everyone knows that you're not alone. Because what I have learned over my years of sales is that getting a no or getting ghosted is very normal. And you just have to get through a certain number of them before you get to a yes. So a couple things that really stood out as the reason why people are getting stuck in those spaces is one, 72% of the opportunities don't show an ROI. So whatever you're sharing with that client, it's not really resonating with them. The next one is 47% of opportunities don't involve the right people. So sometimes you'll meet that person who's like super, super friendly, and you're like, oh my gosh, we just had an amazing conversation. And then you get to the end of like what you think is your process, and they're like, oh, but I can't sign that contract. And you're like, okay, well, we have a really great relationship, but that didn't really get me to where my goal needed to be. And then the last one is 60% of opportunities are actually marked as ghosted, in other terms, sometimes by potential clients. So I wanted to share all of this because I think for those who have not been trained in sales and have not done it professionally, but now are finding themselves in a position where they have to do that on top of trying to promote their mission or their change that they hope to make in the world, they're getting really frustrated and down on themselves. And I want to share this so that everyone understands this is completely normal and it's part of the process. It is nothing personal to you or your mission. A few of the solutions, and this is what I generally am able to offer to people, and I'll talk more about what I can offer to those on the call today, are going over three different topics. The first one is pain points, and it's not just for you, but it's for your clients. It's understanding your clients' pain points and even potentially their clients' pain points. So really moving down the road and understanding the why behind all of these potential challenges that they might be having and not just what we assume. And I laugh because oftentimes I'm like, it's sort of like talking to your best friend where they're like, God, I can't believe this happened. And you immediately know six different data points of why they're upset about this. It's not just because you've inferred from your own perspective. So it's really just knowing people, which leads into the second one, which is people. Making sure that you have the right people at the table, making sure that you're continuously asking questions. Is there anyone else that I should include? You know, I talk a lot about this with my kids, even because they're 10 and 6. And I'm like, did you include everyone who may have wanted to be included? Did you leave anyone out? How can you ask about that? And it really gets to the point of making sure that everyone who wants to be included is invited to the table, and they may actually bring something extra to that whole process that will give you an insight that you didn't even realize existed. And that leads to the third one, which is processes. So this goes directly to getting ghosted, which I know for a lot of people who are dating, that happens a lot very frequently. So it's all over TikTok and whatever else. But it happens a lot in sales, and it's really painful because your livelihood or your mission, whatever your organization values and vision is, depends on it. And so it's really important to have a clear process of what you're saying, how you're saying it, and how many times you reach out to people so that you can lean back on that process when you're feeling super low, super discouraged, and almost desperate. And so it's really looking at those three key points. And that's really what I wanted to share today with everyone on the call and anyone else who you might be talking with, because those are some of the top things that we uncover with a lot of my clients. And it's able to get them out of that muddy, stuck feeling and into the next spot. A couple of things. What I have to offer is a sales growth checklist, which I hesitate to use the term sales because I know it puts people off. I will say most people are selling something, whether it's an idea, a product, a service, whatever it might be, a connection. And so it's just a good checklist to see, do I have the information I need? Have I asked the questions I wanted to ask? And what is my actual goal when I'm talking to someone? And I use this a lot when I'm doing network training as well for people so that when they're networking, they aren't getting totally burnt out. I can also offer a call to go over the checklist with you. But if you know someone else who you're like, I think they might be able to use some of your services, my ask is that you share my email address with them and share this recording so that I can talk to them and see if there's an area where I might be able to support them or someone else that they know.
Great. So I'll give Denise a second to get Trisha in the spotlight. And while we're doing that, I'll tell you about Trisha. Trisha Choi is a seasoned healthcare leader with 25 years of experience driving patient experience, leadership coaching, and organizational transformation across top institutions like Duke, Cone Health, and New York Presbyterian. She's led large teams, coached executives, and implemented high impact programs that improved care and culture system wide. With a foundation in public relations and a master's in change leadership from Columbia, she blends strategic vision with a deep commitment to service and community building. Trisha, tell us about what you're up to.
Thank you, Dawn. So Bahay Kubo is my new venture, and what it stands for in Filipino, which is the roots. My parents are from the Philippines. I was born here. Is it's a home that is lightweight. It's made out of bamboo and leaves, and it's also a shelter either on a farm or at the beach that can be easily picked up by the community and moved to another part of the village. And so as I almost fell and got picked up but on my seat. But so it's really important to build home within oneself so that this home can then be picked up and shared within the community. And this idea is that it is going to be a space within conferences of all industries where an executive can come away from the noise of the busy conference. Many of us are burnt out and tired of hearing the same messages. So they can come into this space and connect with themselves through a creative outlet. And that would be either finger painting or playing some instruments or even creating a pinch pot, maybe doing some silent disco or dancing, and then going back into the space of the conference and hearing something that they will then take back to their home organization where they spend more time than their own home sometimes and make truly transformational change. And hopefully it can be done in a truly creative way and not some boring PowerPoint. As a healthcare executive myself, most of the organizations I was part of never even required me to come back and share the learning that I was so blessed to receive. And so it's that type of transformational change that Bahá'í Qubbo is encouraging and is hoping to build a community around. I am a very big person involved in story sharing, I like to call it, not storytelling. So as a healthcare leader, I've been very vulnerable in my own story. And my history involves going to rehab at one point in my career. And I mean, part of my career. And I think back to the time where my boss said to me that day when I told her I needed to go, she said, let's do it today. Let's teach who's going to be covering you for the 6 weeks or more that you're going to be out, because it's so important that we take care of ourselves. And I could still wrap my arms around her energetically with love because she did it in such a beautiful way. And there was no resistance, there was no judgment. And then I think about a boss that I had later on at another organization who said to me and the team, I need to share with you that I'm going through treatment for depression. And I would be very like two-faced if I didn't stand behind busting this stigma of mental illness. She said, I'm going to be taking medication for depression and it might change me. So I want you all to know. And that really propelled me into this space where I needed to be out about my own story. So I've told my story about having a diagnosis of what I like to call mental wellness. I was diagnosed at 19 with bipolar disorder, and yet I was able to be in my last role an assistant vice president of patient experience. And so I tell this story because as an executive, it's so important to take care of ourselves, but also what can we do to build community with others and to say, you're not alone. And it's important to take care of ourselves. And that's how I arrived at taking this step to creating my own business. And there was also a reduction in force in my role in healthcare. So it propelled me to do something different. I, as you heard Dawn say, have a background in public relations and marketing with a major cosmetic company. I then worked in restaurant startups. I was a celebrity assistant and also worked in healthcare to build a physical medicine and rehabilitation unit with my former boss. And then I went on to work in patient experience, was in charge of patient experience in emergency rooms across the system, and then was blessed to work as a patient experience executive where I coached a team of 4 managers that then had a combined team of 100. And I think it's really important to role model what I'm trying to share, which is authenticity and connection with self so that we can be well. And so Bahá'í Qubbo really concentrates on corporate wellness events. I'm going to give you an example of what we've done so far. We hosted a International Women's Wellness Weekend in Oceanside, California, on the ocean with 3 women who were solo entrepreneurs and now have really flourished in their work since the event. We had the blessing of having Panta Avahidi there teach us her wellness model and her compassion model, and that was something that we all benefited from. I've hosted some wellness retreats with doctors and engineers to see how it changed the way they looked at their offering to their patients. And we are going to be hosting an event with grad students at a nearby academic medical center and their children. So we're having the children lead the way in how important it is to incorporate play and connection to self. So I invite you to take a look at our website. Someone asked me, can you leave me with a visual of what Baha'i Kubo does? And it's on the website, but you can see a picture of executive making a snow angel. Could we be in touch with that person within and just play again, and bring that back to the organizations that we work in? Unfortunately now, I live in North Carolina, and that snow angel could be replaced with a pollen angel because there's so much pollen on the ground. But whatever it is, to embrace the place in which you are. And I like that song from REM. I think it's called Stand in the Place Where You Are, and then make sure that you're actually able to connect within and then bring that with you for wherever you go. So I guess what I'd like to offer is how you might think that Baha'i Kubo can help you or someone in your network. I've been reached out to recently by friends in the armed forces and saying, we really need this in the community of veterans. So if you have ideas like that, I'd like to offer our customizable package for you. And then also, I'd also just ask that you think of places where we could help. And I thank you so much for your time.
Great. Thank you, Tricia. Thanks for sharing so much about your personal journey too. That was an extra special piece that we got to witness. I really appreciate that. So I want to invite everyone to open your mic. And if you would like to ask more question about either Lena or Tricia's work, or express appreciation for their work, or ask for what you need from them, or offer what you can to them. Let's see what we can do to spark some collaboration.
Lena, I'm curious because you also have a group, a network forming around you in regards to some of this work that you're doing. So it's not just you and the great skills that you offer, but you're actually pulling in others with different resources and capabilities. Can you speak a little bit to that as well?
I'm this like perpetual group creator because my ADHD runs wild and I like being around people. So I'm based in Minneapolis, Minnesota, and I've connected with a lot of other folks who are in the healthcare space who have worked as physicians or in really any of the back end business spaces of healthcare. And we've connected together and created a group that attacks kind of all of the non-exciting parts of healthcare that people who are running organizations or trying to like bring their mission to life need, but struggle to find the right people to help them. So it's called the Healthcare Referral Network. Like I said, I have a physician on staff who worked at Mayo Clinic, had his own clinic for a long time, now acts as a chief medical officer for, I think, 13 different nursing homes. He also acts as a startup advisor for medical startups. He and his wife also have a leadership organization where they train physicians who are getting promoted in healthcare on how to be a good leader because they've already gone through many years of training on how to be a physician and not the other aspects of management. We have folks who are in financial advising and specifically cater to physicians and people in healthcare and the unique needs they have. And then we have others in marketing, branding. I do sales. We have someone in legal. So it's really all of those areas where, as a business owner or as someone who is a leader and is looking for trusted voices, we've vetted each other to say, are you a good person? Or are you going to keep playing devil's advocate this entire way through? And people who are really experts in those areas. So I'm hoping through some future work with Denise and Dawn to bring space on HRC platform there so that people can go and see who's available if they ever need help.
Excellent. Thank you. Paul, your hand's up.
It is. Lena, your expertise brought straight to my mind my Wednesday morning 9 a.m. call with the American Board of Artificial Intelligence in Medicine. That's free office hours at abaim.org. Actually, it's basically about 30 people every week half of whom are techies and half of whom are docs, and they're trying to learn how to talk to each other. And all of them creating startup AI find it nigh to impossible to get a product into a hospital.
Mm.
And they might need to learn something about how to sell. So I think just sticking your ear in there and looking at what's there, you might find it's a pretty interesting synergy.
Thank you. I would love that. Yeah, I when I used to work for McKesson, Athena Health was one of the channel partners that I managed, and I got so into the tech, never thought that I would, but it's been very interesting seeing other people bringing their technology in and being like, we're going to get in all the major health systems, and I'm like, you can, and I hope you have a lot of patience and grit because it's going to take you a while.
Quick segue. I'm sorry, but you just made this happen. Uh, I was in a medical group and we implemented GE Centricity. And the woman who implemented it went to work for GE Centricity until she found out GE wasn't going to invest in them anymore. And she moved over to Athena. She had been responsible for 60% of GE's sales.
Oh,
Oh,
wow.
boy.
Yeah. And then she moved to Athena. And then Athena acquired the Beth Israel Deaconess Hospital System from John Halamka, who's a family friend and is now running the platform at where? The Mayo Clinic.
Mm.
So,
Oh my gosh.
there's just a small world, really.
I know. I always joke. I'm like, healthcare is like a Rubik's Cube.
Hmm. But I don't think anybody has figured out how to solve it.
They just made it even more complex.
That's right. Trisha, I'm curious. Tell me a little bit, if you would, the background for what you've created. I assume you told us your personal story in regards to your mental health and all of that, but tell me about going to conferences and what you've experienced. Because I often say, you go to a conference and you're motivated and energized, you've got reams of notes, and then you go back to your job and nothing happens.
Yeah. So I can give you this example. A couple weeks ago, we were blessed to be invited to this first time ever Healing Through Music conference. And at the conference, we experienced different modalities. One of them was physical storytelling. Another of them was using our bodies for music. We would do percussion on our bodies. And then the third one was, I'm trying to remember, I actually walked away from it because the new puppy was on me and it got really hot, but it was actually this fascinating use of breathing and Tai Chi combination with Chinese medicine. And the one that struck me the most was the physical storytelling and how it has stayed with me and how I need to, as an executive, take back what I've learned to my team to truly energize them because they didn't get to go. And it costs anywhere from $5,000 to $10,000 for an executive to go to a conference. And not everybody is blessed to go to that. And my first healthcare organization, New York Presbyterian, when we were doing well, allowed us to go to 2 conferences a year. And in the beginning of the 18 years I was there, we just went. Towards the end of the time that I was there, they said you have to do a PowerPoint and share. I don't know that anybody could remember anything that I took back. But if I could have done it in this physical storytelling way and say, oh my goodness, this is how it hit me. And this is something we should do. And if I could really bring myself to work and not hide behind any veil and truly be myself, how many more of my colleagues and team members could I truly inspire? And I, spent the last year and a half of fun employment doing what I like to call trapezing from one leader to another. We're all leaders. And I remember this one CFO of the Kaiser Permanente system who told me that someone had found him and did a emergency meeting with him that allowed him to tell his story. And I don't think it's a secret, but Adam Niemer is the founder of Simple Mental Health. And he was sharing how he was finally able to tell his story to the system and asked if he could just be please let off and let go so he could make this his livelihood and his job. And that's what he's doing now. He wrote a book and he's just teaching people about simple mental health. So I hope that answers your question. I think it's ripe for the time. And, having worked closely with Dr. Lorna Breen in the New York Presbyterian system for 6 years to bring up the scores from the lowest scoring hospital in the system to the highest scoring. It took 6 years. I know how much we worked hard together. I know that as an emergency room physician, and maybe Dr. Ellison, you can relate, there's a perfectionism to it. And if you, like her, could not save all those people during the pandemic coming into a 16-bed emergency room, you just need to have an outlet to say, I am not perfect. And everything is okay to be perfectly imperfect. And I saw in the chat, Paul, that you had put one of your friends and colleagues who was treated with lithium. I was treated with lithium for 30 years. And then my kidney said, you're in 3rd stage kidney failure. And people were saying, just get on the kidney donor transplant list. It's not that big a deal anymore. And my practitioner was like, are you kidding me? He's also a pastor. He said, I'm going to pray on this. And I'm on a better medication that works for me. And now I'm on, I don't remember what it's, Divalproix, and it works so much better. And I was able to lead a team of 100, on a new medication. And my life is great.
Hmm.
Can I share something really quick? Just a little
Of
something.
course.
So
Please.
something that you said, Trisha, you said, I wish I could just go to be myself at work. Like I could bring myself to work and not hide. And I've been reading this book. This is not my kind of book. My patient recommended this to me, but it's called Untamed by Glennon Doyle. Do you guys know this book?
Yes, it's
Anyway,
great.
I'm going to read you a short paragraph that says, each of us was born to bring forth something that has never existed, a way of being, a family, an idea, art, a community, something brand new. We are here to fully introduce ourselves, to impose ourselves and ideas and thoughts and dreams onto the world, leaving it changed forever by who we are and what we bring forth from our depths. So we cannot contort ourselves to fit into the visible order. We must unleash ourselves and watch the world reorder itself in front of our eyes. Isn't that powerful?
Mm.
That is, thank you. No, I mean, and I think that also leads me to share something I forgot, which is, as a patient experience leader, I'm very tied into the part of it where you have to report your success to the government, right? Through the HCAHPS and through the OAS CAHPS. And there is a part to Baha'i Kubwa where I need to prove, like Lena has in her work, that this is actually going to work. So it's not just this thing that I've dreamt up, like you read from Untamed, but I intend to do a survey at the event, at 3 weeks post the event, and then 3 months post the event, and say, how have you truly brought what you've learned to your organization to make the change? So it's planting seeds that we can do better, and we have to do better, because there aren't so many organizations that are sending their executives to conferences. There's just no money. And so the ones that do, I'd love to work with them. Those are the leaders that are helping to change our world.
We're all interested in reinventing healthcare, and what it really is radical. It's at the roots, and at the roots, life is very simple. So Lena put up 3 bullet points that I could take home in my head. And the simplicity is actually the root of the problem. When you get down to the roots, things get simple. When you're up at the top, it's so complex you can't do anything. So guess what? We can't do anything if we don't start at the root.
Yeah, I totally agree with you, Paul. I think for me, the main issue is we need to have a patient-focused healthcare system, where the patient is the center, and the doctor-patient relationship needs to be the focus of it, and everything else is extraneous.
Right. And we actually, when you learn how hard it is, that's where you come to. It took me forever to get there, but that's where I am too. It's absolutely at the core, and the whole system seems to be built around transactions and forgotten that.
Well, and to piggyback on that, it's a healthcare system where your patients aren't coming to you because they're in crisis. Something is going on that I need your help now, but it is more that wellness. It is the relationship over time through their health and making sure that their health is truly balanced and good. They're getting all the right checks, and through their medical crises. So how do we create a system where we're helping people to not be as chronically ill because we're helping them to be proactive in their care? We're not just checking boxes, but we're actually tuning the care we provide to that individual.
That's what primary care doctors do when they're at their best.
Yeah.
Somebody comes in with bronchitis and you're forced to spend half your time documenting their bronchitis and making sure you're using the antibiotic of choice, which you shouldn't have prescribed anyway, and get it coded and billed instead of saying, so why did you come in with this particular bronchitis? Because usually you don't. And the answer is because my kid's failing in high school. And you had no idea that that was the reason they came in, because you don't have time to do your job. Your job is to do what you just said, Denise, individualize the treatment on everybody and be able to have enough time to say, and by the way, is there anything else?
Right.
Yeah, my mom's dying. Oh, really? Is that relevant or what?
Well, and you're right, Paul, because in the and Lena, I see your hands up, so I'll state this and then I'll be done. But in that visit, especially when it is an acute visit, it is what brought you in today. We're not going to look at the full scope of anything else. You can't ask me those questions. You would have to schedule another appointment for that. It's what brought you in today. That's what I'm going to address.
Yeah, and I'll segue quickly, and then Lena. There was a Kaiser-based pair of consultants many moons ago who talked about max packing a visit, which means put as much into a visit as you can. Today, it's put as little into a visit as you can. I only have room for one question.
Yep.
And that's what it takes for documenting and billing. But the opposite is far, far better healthcare. So what do you want to talk about today? Well, I have a bad cold. Oh yeah, and by the way, you smoke and you're overweight, your cholesterol's too high, and your blood pressure's out of control. Well, which of these do we want to address? Well, which one are you willing to address? Because whatever I tell you isn't going to be what you do. It's going to be what you do out of the list of things you ought to do. Yeah, that takes extra time. And there are too few models where docs have enough time to do their job right.
Yeah.
Lena?
Slow from what I understand, so I don't want to jump in. I have a couple questions about this. Paul and Nona, since I'm gathering you two were clinicians or are currently clinicians. Nona, what's the setting that you're practicing in? Is it private practice? Is it a health system?
I currently do virtual care with a company called Zocalo Health. We provide bilingual care. Most of our patients are in Central Valley, California, and are Latino on Medi-Cal.
Okay. I was just curious when I asked because I struggle as someone who was on the business side of healthcare and then had a lot of issues personally. When I would start to look at the needs of actual patients, I would get so frustrated because oftentimes I'm noticing at the helm are a lot of white men who don't use healthcare. And there's a lot of talk that goes something like, well, they just need to do it or they just need to care more. And it's funny to hear that conversation about Kaiser Permanente and max packing the visit, because as a mom, I would always be like, I need to talk to you about 15 things and I have 20 minutes. I don't want to come back in 6 weeks. So I'm just curious, is there talk at all about, doing something where I don't know if it becomes a CPT code, which everything does, but providing care in that way that's more ACO based? Do you see that picking up anywhere besides just the traditional private practice?
I don't know what ACO is. You threw that in there.
Accountable care organizations. So they'll get paid like one fee per member, and then they're meant to drive down the cost. And whatever you don't spend, you get to keep.
Oh, that, yes.
So
I don't think Medi-Cal does that. I don't think that's what we're dealing with in our service. And honestly, we're up and coming. We're trying some new things. All of my patients are calling me from their house or their friend's house or their car or Walmart, and I'm dealing with there's a lot of health needs and there's a lot of issues, and so I'm doing the best I can to kind of put a Band-Aid over the things that I'm able to help them with, but they can't get in to see their doctor. It's a 6-month wait to get in to see anyone at the local FQHC. And there's no specialists in their area. People that live in King City, California, there are no specialists, for miles around. And Medi-Cal does pay for them to get a ride if it's more than 15 miles from their door. But just getting that ride and arranging all of that when they've got children and elderly, and it's a big problem. So what was your question?
I was just wondering if you were seeing different models. Sorry, I accidentally put affordable care. I'm combining all of the acronyms, but
we are a different model. Yeah, we
Yeah,
are developmental.
seeing
And I
what's
think what we're
happening.
trying to do is we're trying to create a new space of access. Like my patients don't have access to care. And it's not because they won't engage, which I think has kind of been the label that's been put on them is these difficult people just won't engage the healthcare system. But the real issue is that they can't engage it in the way that it's created. It's not created for them. And so what we're doing is my company it was started by Latinos. There are only a few of us that aren't Latino. We all speak Spanish if we're patient facing, and we are creating a space for those people to access the healthcare system. We're kind of a conduit or a liaison between the healthcare system and this huge community of people that have had difficulty accessing the healthcare system for ever. So, yes.
And Nona, you're able to do that from Washington, and your patients are in California?
Yeah.
I know, like my husband, when he was trying to consult with his doctor, he has MS, and he was trying to consult with her, and she's in Oregon, but we're in Washington. When she found out he was calling in from Washington, she had to end the consult because she's not licensed in Washington.
Yeah. Yeah, I have about 25 licenses
I see.
For different states. So if the patient's in the state where I'm licensed, I can see them. And actually live in California. My residency in California. That was my first medical license. But yeah, I can see patients all over the country as long as I have a license there.
Isn't that funny?
And and there are certain things that I can't really diagnose over the phone, but they teach you in medical school that when you're fully trained, which takes about 20 years, when you're fully trained, you can diagnose about 80% of illness just based on the history alone. You've seen so much and you've touched so much. I did urgent care for decades, and I know the questions to ask, and I can tell the patient, well, push here. Where does it hurt? Does it hurt when you push or when you let go? Or take your fist and wrap it around here and pound there, and push here. Does that hurt? I can do a lot of that over the phone, and and people can get healthcare.
So you've just taught us a key thing in how we pick our next primary care. That how many decades have they been in healthcare? That's first criteria. Okay.
I want to confirm that. She's totally right. That's what it takes. Just about 20 years to get really good at it.
Sure. It's that competency scale, right?
I want to also answer Lena's question. What context have you worked in? I spent 39 years in a private practice, but during that time, we also experienced global capitation care with an independent practice affiliation, an IPA back in the 90s, followed by a group practice without walls with 8 horizontally integrated primary cares, followed by all back to fee for service, followed by starting the first clinical integration network in the state of Washington, which rewards the primary care docs for doing better care. And it still exists. That's Eastside Health Network in Seattle. So yeah, if you stay
You were talking about IPAs. They were very popular in Chicago when I was living down there and working with the clinicians down there. So it's interesting to see geographically how different spaces have adjusted to the market. And that was actually my other thought was, Nona, you had mentioned that you have 25 state licenses. I had just heard something, and hopefully someone else can step in here, about there being certain states where they're opening something along those lines, and I'm not sure if it was for mental health or primary care. Has anyone heard about that?
What are they opening? What's your question?
I was starting to see that they're starting to shift the requirements for different care out of state in certain states in the country. It's not many.
I think there are efforts to do that. I don't know that anything has been successful yet.
Okay.
Yeah, I was going to say like legislative actions. I know there's been some talk around that.
A couple of states have eliminated their requirements for a U.S. residency to allow foreign physicians to come in and start practice without having to do residency all over again.
So Tricia, you had your hand up a little bit ago.
Well, I guess two things I wanted to share. Just to piggyback on what you said, Dr. Behrens, as someone who used to run a, what do you call it, a residency program, both at New York Presbyterian, Weill Cornell, and it was when they merged with Columbia. So it was one of the, I think it's still to date, one of the only successful mergers. I was working in the rehab medicine department. I think that residency is such an important period of time in a doctor's formation. And I've recently had an opportunity to speak on a podcast, and they only put a little snippet of what I shared, but I was volunteering with the elderly cancer patients at the hospital. And my colleagues who were residents were like, come on, you should be coming out to the bars on Thursday night. You shouldn't be volunteering. And I was like, wait, you got this all wrong. You're going to be doctors one day. You should be volunteering with me because it's so hard to know how to socialize with patients on a human level. You should be coming with me. And, I think I have lots of friends that are physicians, and I think it's a really important thought. And as I've gone through my life, I shared, not a lot of residents in that period even get to go to 12-step meetings to see like what is that all about and to understand what addiction is. And that's a very important part. I don't know if that's something you could also speak to, Nona. But the other thing I wanted to share is that kudos to Sam, who is right now, you could see him practicing wellness while he's on this. And I don't know if anybody here can see, but he's walking on a treadmill. So that is truly what I, think is wellness is all about. How do you incorporate what you love to do, need to do into your daily existence? And he's walking on a treadmill on this meeting. So that's all I wanted to point out. Kudos to you.
Well, I'm glad that you just did that. You directed things Sam's way, because Sam and I have just recently connected and had a little bit of a conversation as he recently joined the HRC community. And Sam, I wonder if you want to take a moment to share a little bit about what you're doing. I think this audience would be interested to learn more.
Well, thank you for the the podium, so to speak. I'm just thinking where to start. Really, I've always been into technology and figuring out how things work, and wanted to go into electronics engineering when I was graduating high school. I'm from Eastern Europe, and my family is all doctors, so my only choice was to go into medicine. Like there was no other choice, and I thought, I could, I'll give it a shot, and if I don't like it, I could always do something else. And long story short, in residency, my second year, when it's your first year, you just do what your senior resident tells you. Your second year, you're the one who gets all the phone calls from the different hospitals and ER docs and so on. And I realized the system sucks. Like I don't have a better way of putting it. It just sucks. It's a lot of gears that just aren't acting in concert. And my wife tells me I think like an engineer, and she's an engineer, so I take her word for it. And so at the end of my second year, I basically just decided, you know what, I'm going to leave and help transform this thing. And because I can't be the guy who's just doing it because like that's what I was trained in. That's the only reason I'm staying. Because I talked with my colleagues, and literally, and my program director did also the same thing. I would do something else. My program director said I would do something else, but I'm too old. And my colleagues, the other residents, said individually, it was kind of weird to say the same thing. I would do something else, but I don't know how. Mm. And to me, that's a horrible reason for staying and doing what you're doing, because if you're not if there's something missing there. So, so then at that point, that was 2012. I just kind of made my mission to help transform healthcare, and that's kind of what I've been trying to do since. And 4 years ago or so, I met my current business partners, and because I kind of realized the only way I can really change things really at a high level is to just buy hospitals and do it ourselves, or just myself, because otherwise it's really hard to get hospitals or anyone to do the right thing, or there's so many competing interests involved, like you guys have been saying. So, in essence, the tools exist. It's actually, there's books like this, for instance, that I'm reading currently, the Hospital and Clinic Improvement Handbook. It's the combination of Lean Six Sigma and Theory of Constraints, which are, in my opinion, and I'm not like a process engineer, but those are really good methodologies to really get the most out of your system, whatever the system is, without doing the typical things like firing people or lowering salaries or all that nonsense that healthcare systems like to do. In essence, you can increase throughput and lower costs, increase quality, increase experience with the people you have, without hiring more people, without firing any that you have. But just doing common sense things, like once as you read it, you're like, yeah, that makes sense. But like it's what's common sense, but not common practice, I guess. So there's also another book for like throughput accounting. So in essence, currently hospitals and pretty much everyone else uses cost accounting. Cost accounting is horrible because it doesn't actually account for anything in terms of like helping you change the organization or really help you run it well. And the guy who originally came up with this is a physicist and who kind of went into the being a consultant. He helped organizations like factories and so on kind of increase their throughput, lower their costs, increase their quality, so on. But literally, with the people you have, you can increase throughput by like 30% by really just changing. We're just looking at what's happening and then just kind of plugging in what needs to, like where those people are needed and taking people away from when they're not needed. But yeah, and just focusing on the bottleneck. The main point of all that is like you find the bottleneck and you focus on it, you increase the throughput through it. And by increasing throughput at the bottleneck, you increase throughput of the entire organization. If you increase throughput at a non-bottleneck, then you're not doing anything at all. It's a waste of time.
And Sam, you guys are purchasing hospitals or you're starting from scratch?
We are, so to purchase hospitals, we decided to do it to bootstrap it because we don't want to deal with like investors and, you know, like it takes a lot to be on the same page as we are because we have consulting companies like our healthcare operations consulting. So we'll help hospitals not suck, and between us, and we have software that does a payer audit in like a day, like a 12-month payer audit in a day, and it shows the hospital where all their denied and unpaid claims that can still be recovered, and it tells them what needs to be done to those claims to be submitted and reimbursed. And then by doing that, we also get the data to really even give them the data for their charge master management, 340B if they qualify, kind of care management, and what was the other one? What the other one was, but basically, and literally within the day of getting their data. Yeah, and then so using the money that we make from this, then the idea is to fund hospitals with that. But to your point, we're still pretty early. I mean, we don't have anywhere near the money we need to actually buy one, so we're still kind of at that point of
consulting,
making that money. Yeah, exactly.
Yeah.
But the idea is to, and we're talking with some people actually, that might help us buy hospitals too, or at least provide financing for it. So we'll see.
Excellent.
So that was a long-winded answer to answer your question. I don't know if I said.
Oh, I put you on the spot. I'm sorry. I thought it was great though.
That sounds exciting.
Yeah.
And
Lena's
is
trying.
it rural? Oh, sorry.
Go ahead, start over.
Go ahead.
Lena, we got
Your mic is slow. Yeah, go ahead.
Guys, I mean, I got a mic, I got a boom arm. I'm like, how am I having problems with this today? But Sam, I was curious where you're targeting your efforts. Are you looking at rural hospitals? Are you looking at a certain size? It's so fascinating, like what you're doing right now, and I would love to learn more.
Oh, thanks. Yeah. So our passion is small rural hospitals because I actually did a podcast earlier today with the doc who's also looking to buy hospitals, and he's been in rural healthcare for also like a few decades. And rural hospitals are not in the position to really be that competitive a lot of times because number one, they don't know that they can negotiate with insurance companies. So whatever the insurance company the contracts they give them, they're like, okay, and just kind of take it, which is insane. Like, so the insurance company's like, here, we're going to pay you 50 cents on the dollar for how much it actually takes to treat a patient.
Yeah.
They're like, yeah, sure. Sounds great. And no wonder they're losing money, right? So, but yeah, if a hospital in the rural area, goes out of business, then all of a sudden, patients have to drive 40 minutes, an hour and a half, 2 hours to the next hospital. And that doesn't do anyone any good.
Thanks, Sam, for speaking up and being put on the spot like that. We really appreciate getting to know, especially our newest people. That's awesome. I just want to make sure that we get our announcements in before we call it quits today. I want you to know that the next Shine a Light is May 20th. We have a public event on May 28th called Too Big to Heal, which is a debate about national versus local solutions to health. And please engage with the people you see here on the platform. We want to kind of drive you to that platform so we have more engagement. If you're not a member, do we have a link in the chat for becoming a member?
It is there.
Excellent.
Yep.
All right. And please do complete our survey. I know we've plopped that in the chat a couple of times. So please do complete our survey so we can know how better to serve you, because that's what we're here for.
You know, and just as we tag on at the end here, I love this event, the Shine a Light, when we're actually saying, here are healthcare change makers. I call them ruckus makers who are doing exceptional work. We're shining a light